It's Kishi. It's been such a long time, and I'm sorry that I have been MIA. My son, Trey, is 8 months old now as of this past Saturday, and I just wanted to try to catch everybody up with what's been going on with us. He was born on May 26th, 2012, and I had him at the hospital. I was, I technically had him one day before my due date, but a quick recap because of all of my miscarriages and all the difficulty getting pregnant and staying pregnant and everything, I was considered high risk. So I was seeing a high risk doctor, and near the end of my pregnancy, I had one more ultrasound. And they found that the circumference around Trey's stomach was measuring almost 4 weeks behind. So they, wanted to induce me to be safe just because they were afraid that the placenta wasn't giving him any more nourishment. So he wasn't thriving in there. So they said, what are we waiting for? You're virtually at your due date, so let's get him out. So with everything that was going on, I was not going to take any chances, so I was going to listen to the doctor and go with it. So that happened on Friday afternoon. I had the ultrasound, and then they had me drive to the doctor's office so he could meet with me and basically give me the options. His feeling was just go with the induction just to be safe. And so I called my husband and said, get my stuff ready. Even though I had my bag packed, I was so excited, but I was nervous at the same time because, I wanted a natural birth. I didn't want to have to get induced or anything. But in the same time, I knew that he was going to be here within a day or two. So I was super excited. Got my bags. I went home, got my bags. My mom and my best friend came. My mom drove. She lives about an hour and a half away, and my friend lives about 30 minutes away. So they came to my house and they brought me to the hospital. And I'm going to try to make this as fast as I can, but I guess I'm going to make this my quick update. And then the longer part of it is going to be the labor and delivery. And so I was I had to be at the hospital by 6:30. Then they gave me what's the medicine called? Cervidil, which is a vaginal suppository type medicine. It kind of looks like almost like a tampon with a long string. So they put that in, and I think around 6:30. And I started having contractions pretty soon after that. And all night I was laboring. I didn't know I was laboring because, hey, it's my first time. I didn't know, and I thought it was like the lead up to it. And the contractions were intense. They were so close together. They were like a minute apart all night. And I sat on I sat on the yoga ball, the rocking chair, and like would try to sit on a chair and then like lean to the bed to get the pressure off my back because I had back labor, so it was all my back. In the front, when I have a contraction, I would feel it in the front, but it didn't really hurt that bad in the front. It was all the back, lower back. And so I definitely suggest any of my pregnant friends watching this, or anyone TTC, when you do finally succeed and get pregnant, I suggest bringing a heating pad. That's definitely for baby number 2. I will bring a heating pad because most likely I'll have back labor again. And that would definitely help a lot of the pain. They had like blankets that they could warm up at the hospital, but they felt cold, like, because they had keep it so cold in there that it didn't work. A heating pad for sure. Definitely number 1 on my list. And the yoga ball, I barely could sit on it just because I was in so much pain. It was hard to really move around. And so, okay, let me get back on track. Otherwise, this will be like 2 hours. But, so let's see, 6:30, they gave me the Cervidil. All night I labored. In the morning, the new nurse that came in, she allowed me to shower because I knew that I would be having him and I wanted to be fresh and, try to blow dry my hair and just be ready. So the doctor came, so I showered. In the shower, my best friend had to help me shower because I was having contractions between 30 seconds to a minute apart. And they were really, really intense. So, and they were just back to back to back to back. And so I knew something had to be going on. Then the doctor came in and he checked me And I don't remember exactly how many centimeters. Oh, you know what? I was 4 centimeters. Because at that point, I was like, this is my first time, going through labor. And I was like, I'm probably not going to deliver until Saturday night. That's what I'm thinking. Late afternoon, Saturday night. And so I was like, at this point, I was like, well, they're already inducing me. They're already giving me medicine. So I think that's when you consider not a natural labor anymore. So I was like, whatever. So I was like, at this point, I'm like, give me the epidural. It's like, sign me up, because I am 4 centimeters dilated. I asked the doctor if let me backtrack. The whole reason, not the whole reason, but I wanted a natural labor, yes, because I wanted less medicines as much as possible and everything, but also I was terrified of a C-section. I was so scared of a C-section. I was afraid that if I got the medicines, it would lead into the next thing, and end up with a C-section. So I asked the doctor, at 4 centimeters dilated, what's my likelihood of needing a C-section at this point? Is it, am I going to stop dilating? And then because I got the epidural, is it going to run out too soon? Or I didn't really understand how it worked, because I didn't really look into it that much, because I was like, I really didn't want it. But I also signed the paperwork weeks in advance that if I wanted it, I could have it. And so I was like, all right, well, at this point, let's give me the epidural. And he broke my water, and to find out that there was a lot of meconium in my water. So the doctor looked up. I'll never forget him looking up at me. I don't want to get emotional. I'll never forget him looking up at me and saying, we made the right decision. And as some people watching this that don't know, meconium is when the baby poops. It poops in utero, which can be extremely dangerous because it gets in the baby's respiratory system, and they can have trouble breathing when they're born, and can actually, I believe they can die from it. So I was glad that we induced, and when he broke my water, he looked up and he said that. So I was like, okay, I'm doing the right thing. And I was like, okay, well, if I'm going to be in this type of pain for this many more, I don't even know, 10, 12 more hours, I was like, I can't handle it. And I was like, okay, give me the epidural. So he's like, okay, well, it was on the weekends, on a Saturday. He's like, there's only one anesthesiologist here. So they're on another floor doing somebody else. There's another patient, not a labor patient, but in surgery or something like that. So, they'll come when they can. And so I was like, okay. So once you make the decision that you're like, give it to me, you're like, you want it now. You're like, give it to me now. Well, this was the doctor broke my water at 9:30 in the morning. And I was like, okay, so 9:30 in the morning, give me my epidural, late afternoon. Okay, we're good. Well, after he broke my water, labor progressed, immediately. He left, and then I started having even worse contractions. And the scary part, though, is that Trey's heart rate dropped, and it wasn't coming back up. So they called, the nurses, and they had the siren, the bells, and the scary alarm was going off on the heart rate machine. And so a bunch of nurses and everyone came in, and then they're putting the pressure on my belly and trying to keep the heart rate monitor on Trey. And but no one's communicating to me. What is going on? No one's communicating and telling me, his heart rate's dropping and it won't come back up. They're just a bunch of people coming in here in the room. And then I hear in the loudspeaker, they call the crash team, and the respiratory crash team, to come into the room. And I'm starting to have panic, not, if someone would just explain to me what's going on, then I could understand, and then tell me, what do I need to do, and what are they going to do to me? So nothing is in shock, whatever you need to do, just do it. Make sure that he's okay. And my best friend was in the room with me, and my mom didn't make it there. She was at work, and because everything happened so quickly, my mom didn't make it there. And that's a whole other story. I was really upset about that. She was really upset about that. And but anyways, my best friend was in the room, and she is an RN. And she actually is the one that figured out the bed, because they were trying to figure out how to lower my head to get the blood from my feet, like raise my feet up, get the blood from my feet to go to Trey, to get his, his heart rate to go back up, to give him all the blood supply. And so she figured it out. And so they lowered my head. I physically kept my feet up in the air. And they called the doctor, had the doctor come in, and basically they told me that, oh, and by the way, TMI alert, one of the nurses had her hand up there and on my in my cervix, way up there. And girls, when you're having a contraction, you do not want anyone touching down there. Like, it hurts really, really bad. And so she had her hand up on my cervix, and I don't know what she was doing, but I'm pretty sure what it was is she was feeling around the baby's head and around the neck to make sure that the cord wasn't around the neck, and the cord was around his neck. And but I forget the name of what it's called, but there's some kind of thing that they were telling me about the night before. The nurse was telling me that if the cord gets trapped beneath the baby, and as the pressure of the baby coming down, it could cut off the blood supply to the baby, which in that case the nurse will hold on to the cord, and they would literally wheel the nurse on your bed while she's holding the cord, and they will take you into emergency cesarean C-section right then and there, with her literally down there holding onto the cord. And so in my head I'm thinking, oh my God, that's what's going on. Like, oh my God, this is what they talk, this is when you hear like an emergency cesarean, this is what I'm thinking in my head. This is what's going to happen. And so I guess she was feeling for that, and she had her hand down there, and I'm kind of like getting kind of like, ow, like, stop, please, and begging, like, please get your hand out of there. It hurt really bad. And meanwhile, someone else is pushing on my stomach with the heart rate monitor while I'm having all these contractions, because I had the Cervidil. They took the Cervidil out, then they broke my water, and then everything is just like, progressed so quickly. And I was 4 centimeters dilated when the doctor broke my water. And then within 15 minutes, I say, this is when this all started going down, or maybe 30 minutes, this all happened. And then the doctor came in. Sorry, I'm rambling, but the doctor came in, and they basically said that my cervix melted open from a 4 to a 10 in her hand. Like, it literally, I dilated in her hand, basically. And the doctor came in, and he was putting his scrubs on and everything, and he was like, we're gonna have a baby. And I was like, oh my God, like, my mom's not in here, my husband's not in here. Like, I was like, no, I can't have him yet. And so luckily, my best friend called my mom. My mom was on her way, but she didn't make it in. But she was like, call her husband. And luckily, he was downstairs with his parents. And so he ran in, and he made it just in time. Thank goodness. And the doctor was like, when you get that feeling to push, and I'm like, you mean like right now? And he's like, yes. He's like, when you feel like you're gonna have to poo, he's like, start pushing. And I was like right now? And he's like, okay, start pushing. And he was so calm. He was a doctor, he wasn't a midwife, but he had he's known as like the midwife type doctor, so he had this like calmness about him, and he was like counting, and he was like, I don't even remember what they count to or whatever, but he was counting for me. And it was like, okay, push, And then I could feel, he's like, okay, put your hand down there. And he's like, you can feel him crowning. And so like I put my hand down there, and I could feel like a little bit of hair and like the little coney part of the head. And I was like, oh my God, like I could feel it, And he was like, okay. And then we counted, and like push and everything. And he's like, okay, you put your hand down there again, you can feel it again. I'm like, nope, I'm good. But something about it, feeling like the cone head of it and the pure adrenaline that I was scared that something was going on was just like, just get him out. And so I was like pushing with all I could, and literally, like, not to brag or anything, but like those stories that you hear about a mom pushing a van off of their child that's trapped and, got hit by a van or something and it's underneath it, like that adrenaline, like you could do like unheard of things. That's the feeling that I had. And I literally I pushed Trey out. I think they said they looked at my contractions, like we went back and looked at the tape, like the paper. I think it was within 5 contractions of me pushing, he was out. He was 6 pounds, 2 ounces, 19 inches and a quarter long. And, yeah, that's the size of him. So he was on the smaller size, but I pushed him out. And then the funny thing is, okay, my husband has like severe anxiety. But the doctor didn't know that. And he's like, okay, Dad. He's like, okay, go ahead and cut the cord. And then so, that was a big deal for my husband to be in there. And then for him to, like, quick, gave him the scissor, cut the cord. And so he was about to cut the cord. And the doctor, to lighten the mood, decided to be like, oh, no, not his penis. Like while he was about to cut the cord. And so my husband was like got all scared and stuff, but like it was like so not cool, and he ended up cutting the cord. And so he was there to witness it. He got to cut the cord, and it was like the most amazing feeling. Like, I tell you, after over 2 years of trying to have him and having 3 miscarriages and dealing with the PCOS and not ovulating on my own and the metformin and the Clomid and everything like that, and it was all worth it. It was all like to hold him and to know that I finally made it and that he was real, and like everything going through it, it was the most amazing thing. So please, I know I have a few friends who are still trying, and don't give up. Whatever way you have to have a child, whether it is IVF, Clomid, donor eggs or donor sperm or donor embryos, adoption, anything. The moment that you find out like this is your child and you finally are there, it's definitely worth it. I know it's hard to see it when you're going through it, but I'm so blessed and thankful to be at that point. And it was like so surreal, like to know that this amazing creature, is mine, and I did it. So, okay, well, this is my first time making a vlog on this new phone, so I'm gonna go ahead and end it there because I don't even know how long this is gonna be, so hopefully it will upload, but there's gonna be more videos to see. Alright, thanks so much for watching. Bye.